Alright, so this is the second part of task 15. We're going to start off by weighing our patient. And so she is 14 pounds. We're going to move this out of the way. And then we're going to write this down. And we're just going to kind of keep track of all her parameters and stuff. So we're going to start off with her head and just kind of looking, checking for any bumps, any kind of hair loss, anything like that. And then, so we're going to start from the front and kind of work our way back. So we're going to look in our eyes, and then we're looking for any kind of little masses on the eyelid, checking our sclera and everything, conjunctiva, make sure they're not red, any swelling or anything like that. Any noticeable scratches, ulcers or anything like that, and then just kind of the cloudiness in the eyes, which she does have a little bit just because she's an older girl. Checking our folds, making sure there's no redness, no sores underneath, anything like that, and looking at her nose for anything abnormal, again any swelling. She does have a little bit of dry skin on her nose. And then we're going to look in our mouth and kind of lip our lip, just kind of check in our refill times, making sure that it's less than 2, making sure we're good in pink, kind of looking at her teeth, and checking. She does have some heavy tartar, no gingivitis. They look pretty good. And then she'll let you kind of look in the mouth for any masses, any swellings, if they'll let you do that. Kind of feel it under the tongue if you can, and look at that. And then we're just going to kind of look at our ears, looking down in the ears, looking for any discharge, any masses, any discolorations, any sores. But her ears look great. But we do want to kind of feel around. You're feeling for lymph nodes. Our submandibular, the prescaps, anything like that. And then you're just kind of feeling the neck just to make sure that there's no pain, any there, and just kind of general, kind of down the front legs, masses, any soreness or anything like that. And then you're just kind of looking at her toes, just checking between the toes for anything abnormal, checking her toenails. Her toenails are a little long. Kind of on the pads, checking between toes, and just and generally trying to make sure that there's no pain or anything like that. So far she's looking pretty good. She does need her little nails done. And then you're also kind of, like I said, going back, checking the spine again, kind of all the way down, checking for any soreness, anything like that, feeling for any lumps. Feeling the abdomen, checking for anything abnormal in our abdomen, any pain, any masses. And then you're just kind of feeling down the back legs, and you're also checking those popliteal lymph nodes. The tail, make sure that looks good. You're also checking your rectum. Make sure that there's no swellings there, no masses there, and that it looks all good. And then you also, in the female, you also want to check her vulva, make sure that there's nothing there. And that looks good there. And kind of checking her back feet also. You want to make sure that there's no problems there. Looking between the toes again. Okay, and then so then I'm going to just go ahead and listen. A good heart rate is between 70 and 120. And you want to listen, there's 4 different quadrants you want to listen to. And while you're listening, you want to check femoral pulses. Making sure that you get a beat with every one of them. And I am getting one, they're the same. Okay, and I've counted for 15 seconds, and you can multiply by that by 4. Your beats were 20, so that gives you a heart rate of 80, which is about normal. And then you're just kind of watching her breathe, and you want to count her respirations. And I'm getting about 20, so it's the same thing. You count breaths, and then you multiply by that by 4, and their breaths are usually about 10 to 30, so that's pretty normal with that. And but you also need to listen to her lungs. So when you're listening to that, you're just listening for just any kind of weird lung sounds, any crackling, and then if they sound wet, anything like that. And as far as listening to her heart, you're just listening for any kind of strange beats, any drop beats, and gallop rhythms, something like that. Anything abnormal. So we're going to write this down on her sheet. So her heart rate was 80, respirations 20, and then we didn't find anything abnormal on her. She's looking pretty good. But everything sounds good. She's looking great. Like I said, she just noticed some cloudiness in her eyes, and some, dental tartar on her teeth. They look good. She is missing a few teeth. She does have some wetness in her eyes. She does have some tearing. She does have those pugs with the entropion, so she does kind of tear up a lot. So, but basically everything, that's what you're looking for in a physical exam.